Good morning. Thanks for joining me today. We're going to start this morning with some mindful breathing, and I have a few exercises for those of you who may be jaw clenchers. Let's lie down on the back here. And I'm going to have you bring your fingers just to the tops of your ears. And if you move toward your eyes, you will feel two bones there. Those are your cheekbones, for want of a better word. And just line up your fingers along the line of those bones and just gently press in toward the center of your head and pull slightly back and pull slightly forward. And then gently pull up and gently pull down. So I've lined my fingers above the bones and I'm just going backward and forward and slightly up and slightly down. If you clench your teeth in tension or you clench your teeth while you sleep, this may be something very helpful for you to do on a regular basis. Again, just forward, just back, up a little, and down a little. And just a couple of times. I'm going to move my hands now to the base of my ears, find my jawbone. And if you feel behind your ears, you will feel two little knobs of your skull. And if you continue to move your fingers around that area, you're going to find a divot of soft tissue. Open up your mouth and close your mouth, and you'll notice that that's a joint right there. That's that joint where your jaw connects to your skull. Just gently work into that hinge. Notice if you open your mouth, you can find tender spots. And it's really those places that we find that make us want to jump back. Those are adhesions. That's what we're looking for, those little adhesions. And those places that make us want to jump back are the places we just want to investigate. You're not trying to necessarily take anything away. It's just investigating, feeling into it, noticing that there's a lot of tightness there. This is something that you can just check into during times of stress. Am I clenching my jaw? Am I tightening up in through there? Or maybe we don't even realize that we're feeling stress, and we kind of feel into these areas and we feel a lot of tension, or it's painful to the touch. That's an indicator that something is causing us to tighten up in there. So this is just a way of giving you a little bit of relief in this area. And if it is very, very sensitive, it doesn't hurt to manipulate it with your fingers for just a few minutes when you awaken in the morning. It will get better. This is something you can do yourself that will improve this condition. So let's go back to our mindful breathing here. Inhale through the belly, feel the belly rise. Exhale, feel the belly fall. Inhale, fill the belly. Exhale. So make an effort here. Fill the belly. And then actively pull the belly toward the spine. Separate the ribs and pull the ribs down together. Incorporate your chest. So all of this can be very active and very systematic. Pull your chest toward your spine. And as you do that, press the middle of your shoulder blades into the floor. Inhale, fill the belly, fill the core. Exhale, pull your chest to your spine. On your next exhalation, gently roll to your right shoulder, just a little bit. You're going to feel yourself pressing your entire right arm into the floor. Your left arm is going to lift off the floor just very slightly here. Let's see. So I'm just pressing into the right. Inhale, center. Exhale, rotating my head, pressing into the left. Inhale, feeling my chest fill, pressing into the right. Inhale, pressing into the left. As I press, I'm reaching the arm away from my body as far as I possibly can. So reaching actively. Now really extend out through those right fingers, the thumb, index finger, middle finger, ring finger, pinky finger. Spread the hands, make a fist, clench the fist and flex your wrist, and then open thumb, index finger, middle, ring, pinky, and then open up the back of the hand, and we'll just relax. Inhale, rotate to the opposite side. So I'm really pushing my arm as long as I can, extending thumb, index, middle, ring, pinky, opening up the hands, and then bringing them into a fist. Pinky finger, ring, middle, index. Clench the fist, lift the fist. Open thumb, index, middle, ring, pinky, and come back to center. Turning my attention to my feet now, bringing my hands to my side, pressing into my feet as if I'm trying to push my body toward the opposite wall or to push my body to the head of the bed if you haven't gotten out of bed yet. Exhale, push your feet into the bed, into the floor. Feel that nice stretch at the backs of your shoulders. Inhale, relax. Exhale, push. And notice you can tuck your chin, and you can feel that stretch in the back of your neck a little bit more easily. Also, rotate your hips. Rotate your hips so that the hips are aiming toward the backs of your knees. Lots of the same thing here on a daily basis, but this is what we're doing. They're very simple things. We just need to do them every day. So as we push with the feet now, we're going to think about pulling the elbows down toward the feet. So I've spread my collarbones as wide as I can. Hands are on my hips. And as I push up toward the head of my bed with my feet, I'm sliding the backs of my hands, I guess the pinky side of my hands, toward my feet. And feeling this stretch that runs down the upper arm, that runs through the shoulder. So when I inhale, I'll relax. Exhale. Hold the elbows toward the feet and push the hands into the waist. Inhale and exhale. One more time, inhale and exhale. We're going to hold that push now, pushing my hands in the waist. Pulling the elbows down toward the feet. And see if you can't, again, widen your collarbones and flatten as much of your upper arm to the floor as possible. And now as you breathe, just focus on your upper arm and chest. Exhale, press the upper arm to the floor, pull the chest toward the bed. Inhale, fill. Exhale, upper arm to the floor, pull the chest to the bed. And hopefully you're feeling this in your chest, in the backs of your shoulders. I find this just feels so good in my elbows. If you're arthritic, all of these exercises probably feel pretty good. If they're painful, I wouldn't recommend avoiding them altogether. Now, I'm no doctor, so I'm not going to make any or provide any kind of medical advice. All I can say is that gentle movement, very gentle movement, isn't going to hurt things. So as we come back to center, rotate your head now over to the left. Press your right arm, your right elbow toward your right foot. Pull your right shoulder away from your right ear. And notice when you rotate your head left, you have to contract through the left side of your neck and relax through the right side. So as you exhale, press that right shoulder to the floor to anchor it. Press the right elbow to the floor. Relax through the neck. And press the left side of the head and the left ear toward the floor. And then inhale and come back to center. Relax everything. We'll just take it to the opposite side. So I'm rotating over to the right now. Same thing, hands against the hips. Pulling my upper arm and my shoulder toward the floor and down, anchoring them nice and firmly. And remember, that's your anchor. So if we have a rubber band on the left side of our neck, we're going to hold the rubber band down on one end and we're going to try to stretch it in the opposite direction. And that's what we're doing when we pin the upper arm and shoulder into the floor. And then just rotate. So the shoulder and the upper arm, they are stabilizing. We're going to let go in the neck, in the left side of the neck. And notice you need to contract through the right side of the neck in order to pull the chin to the side a little further. And on your next inhalation, just relax everything. Bring the head back to the center. Let's bring the right knee into the chest. Just keep your left foot on the floor. Flex your right foot and point your right toe. Flex and point. Flex and point. Now, as we flex this time, we're going to exhale and bring that knee into the chest a little bit. Point the toe and release. Flex, bring the knee into the chest, point the toe, release. And now we're going to incorporate breath. As we flex and pull the knee in, we're exhaling. And notice why we would do that. When we exhale, if we're pulling the belly down toward the floor, it's going to create a little more space for that knee to reach up toward the shoulder. So flex and exhale and flatten and feel that stretch in the crease of your knee. Relax, point, fill the belly. So flex, slide the knee toward the shoulder, pull the navel away, feel that stretch. Point, relax. Inhale as you point. So exhale, flex and flatten. Inhale, point, and relax. Exhale, flex and flatten. Inhale, point and relax. One more time. Exhale, flex and flatten. We're going to hold this now. Keep breathing, but hold the effort. Each time you exhale, you're going to flatten your stomach and feel your thigh coming a little closer to your body. Inhale, relax a little bit. Exhale, come back down. One more time. Inhale, fill. Exhale. Now keep your knee right where it is. And this time we're going to think about the hands and the elbows. We're going to pull the hands away from each other by pressing the elbows toward the floor, but we're going to resist the hands separating by gripping with the fingers. So exhale, pull with the elbows down, resist with the fingers. Inhale, relax. Exhale, pull down with the elbows, resist with the fingers. We'll do 2 more of those. And relax, and we'll switch sides here. So same thing, opposite side. Lace your fingers now backwards so they feel a little bit awkward. Place them on the shin. I'm going to flip around here. So as I exhale, flexing the foot. Inhale, pointing the toe. Exhale, flex the foot. Inhale, point the toe. And this time as I exhale, pull that knee toward the chest a little bit. And remember, when we exhale, we drop the belly toward the spine. And that makes more space for the thigh to come a little closer to the shoulder. So, inhale, point, fill the belly, relax. Exhale, flex, bring the knee closer. Pull the belly down. And now hold. You can point your toes. And here we're going to, again, just pull the elbows down to the floor. Resist with the fingers. Inhale, relax. Pull the elbows down. Resist with the fingers. One more time. We'll bring both knees into the chest. Reach for opposite elbows. I would suggest placing your left hand on the inside and your right hand on the outside. We'll point the toes actively and just feel the stretch in the tops of the feet and feel the contraction in the bottoms of the feet. Can you curl the big toe, second toe, third toe, fourth toe, pinky toe? And then extend the toes. Pinky toe, second toe, middle, fourth toe, big toe. One more time. Curl the toes. And even feel that. Notice how when you curl the toes and flex the feet, curl the toes and point the toes. So it feels a little bit different. And you might be getting a cramp. If you're getting a cramp, relax, flex your feet, and pull your toes back toward your face. So cramps are alarming, but if we stay calm, we can manage them and we can come out of them. Just, again, if you're doing something with your body and it's starting to cramp, relax and do exactly the opposite that you were doing before and just breathe. One thing I frequently say in this class, and as I'm talking, we're just going to rock side to side. A little bit of physical discomfort is a way of self-inflicting some stress. And this is a great little laboratory for practicing managing stress. When we have pain like a cramp or pain from holding a posture, I certainly don't recommend that you stay with it past the breaking point. Again, that I am not a doctor. This is not medical advice. I am interested, however, in playing with that stress a little bit. This is where I can safely investigate the discomfort. Oh gosh, I don't like it. I want to run away from it. I want it to stop. I'm ready to do anything to make it stop. And that's where I have to breathe and try to relax and accept what's happening and try to manage it that way. Let's go ahead and drop the feet back toward the floor. Gently drop the knees side to side. I'm going to do one last exercise to open up the lower back. I'm going to have you cross your right ankle behind your left foot. So right ankle is crossing behind the left foot. And I'm just going to push down with the left foot and push the right ankle into the left foot. So like my right ankle is trying to straighten out my leg, but my left foot is pushing so firmly, I'm not letting that happen. Now, I can press my right thigh down to the floor. And then from there, turn my attention to my lower back and just begin to breathe again. Inhaling into the belly, exhaling, pulling everything toward the spine. So my right thigh is on the floor or on the bed. My right ankle is gently pushing into my left heel. My left foot is pushing down on the floor. And as I exhale, I'm pulling the navel toward the spine. Inhale, just let it all go. If it feels okay and you want to try reaching down for that foot, you can do that. And instead of pushing the foot against the ankle, you would just push the foot against the hand. And we're just lengthening through the front of the hip, the front of the thigh, and stabilizing with the back. One more time in. As we exhale, push and relax. We'll just bring that knee back to center and we'll switch sides. So this time I'm going to cross the left knee underneath or left ankle behind the right foot. I can just play with my left knee, pressing it down onto the floor, and you'll see that my back is popping up off the floor. I'm pretty tight right now. My back is popping up because my back is kind of tight. So I'm going to situate myself again so that my back is pressed to the floor. And then when I push my foot against my right ankle, that push helps me to stretch through my left thigh. And that helps me to bring more of my back to the floor. When I inhale, just feel the belly. When I exhale, I'm going to try to stabilize my back and push that left foot against the right heel. Inhale, exhale. Inhale and exhale as fast or as slowly as is appropriate. Just stay mindful of your back and mindful of how if you stretch your left thigh, it will help you to stabilize your back to the floor a little more easily. And if it's appropriate, reach for that foot. That will help you to press a little more firmly. As I exhale, pulling the navel toward the spine, bringing as much of the back to the floor as I can. Take one more breath here. Exhale, pulling the navel toward the spine. And gently relaxing. From here, just spread your legs out. We'll come into final Shavasana. Relaxing to the floor and feeling into the body. So this is where we're trying to incorporate a little mindfulness with the movement itself. Remember that mindfulness is being aware of what's happening in front of us. And I've always found exercise to be useful for that, because if I'm focused on those little fine points, I'm pretty focused. I'm not thinking about much except what's happening in my body. And that's what we're trying to do when we meditate, when we practice mindfulness. So gentle body movements, in addition to strengthening joints, increasing flexibility, increasing the strength of the core so that we breathe more efficiently, also helps us to learn to be more mindful. And that is the whole purpose of the program. Just relax into your body and feel what's happening right now. There are sensations in your body that are a little more prominent right now because you have done work with your muscles. You have worked with your muscles. Any type of work produces waste product from the cells, and that has to get removed. And it's taken away by blood. Blood is the only thing that can get in there and clean that out. So anytime we tense a muscle, if we relax it, you'll feel a little bit of heat, you'll feel a little vibration. That's your body cleaning itself out. Anytime a cell works, it produces waste. And the only way that waste gets taken away is through blood circulation. So if we can get ourselves to let go completely after we exercise every single time, which is so hard to do, I couldn't agree more. But if we can get ourselves to let go and be still for just a minute, that is the most efficient way to bring blood into those areas that we've just worked. To clean them out, to bring in nutrition to the cells. And this really is happening on a cellular level. The tiniest, the smallest, most seemingly minuscule things, but so many cells. And these things happening day after day after day of a long life. It makes a huge difference what you choose to attend to, what you choose to turn your attention to over the years. So we've talked about moving the body and stillness, not moving the body. And I want to distinguish that lack of movement follows a little bit of movement. The recommendation is not that we just never move, because that slows everything down and things don't move. The blood doesn't move through the body. When we're moving around and tightening and pulling and pushing here and there, we're contracting the muscles. All of that is moving lymph, it's moving blood, it's strengthening blood vessels and veins, the valves that actually hold the blood in various areas of the vessels. And then we stop and just notice, just feel all that nutrition running through the body. It doesn't take much. If we can find something that we can stick with, something that feels comfortable and we don't hate, it's easier to do it on a daily basis. We'll bring ourselves back from Shavasana in any way that's appropriate for you. A long stretch, movement side to side. Whenever you're ready, rotate to one side and rest on your shoulder. Just make sure there's some blood in your head and you can gently come back to an upright position. Thank you so much for joining me this morning. I hope this was useful for you. I will be gone the next week. So the next live session will take place next Saturday, March 30th. So I look forward to seeing you then. I hope that you can make use of the videos. Have a wonderful week. Namaste.